Tobacco is a leading global cause of death that kills nearly 5.4 million people every year. In India, the high prevalence of tobacco consumption is one of the major challenges to the health and well-being of its citizens. About 2,500 Indians die every day, and approximately 10 lakh people die annually due to tobacco use. Findings from the Global Adult Tobacco Survey India 2009-2010 reveal that the estimated number of adult tobacco users in India is 274.9 million, and this number is growing rapidly, especially among women. Research estimates that nearly 5,500 youth in India start using tobacco daily. Pictorial health warnings on tobacco product packages have been scientifically recognized and are shown to be an effective measure of tobacco control in many countries. Strong pictorial health warnings effectively inform youth and people with low literacy rates in particular about the adverse impacts of tobacco use. Recently, the empirical evidence on India's poor standing in pictorial health warnings vis-à-vis numerous countries across the world has been on the rise. In 1975, the Indian government passed the Cigarettes Act, which introduced the first text-only specified health warning on cigarette packets and advertisements. Other tobacco products were beyond the purview of this law. Over 2 decades, scientific evidence on the health hazards of tobacco use grew, and a civil society movement pressing for stronger tobacco control measures gained momentum. In 1995, a parliamentary committee report suggested the use of symbols and pictorials to make statutory rotating warnings effective. Large warnings in regional languages were also recommended. After 2001, when the Parliamentary Standing Committee on Human Resource Development recommended mandatory pictorial depictions of warnings like skull and crossbones on all tobacco product packages, tobacco control organizations scaled up efforts through policy, legal, media, and youth advocacy to introduce pictorial health warnings. Article 11 of the WHO Framework Convention on Tobacco Control requires parties to the convention to implement large, rotating health warnings on all tobacco product packaging and labeling. Pictorial health warnings on tobacco packages are a cost-effective means to increase public awareness about the dangers of tobacco use.
It is fairly well known that tobacco causes diseases and kills people. But many people who consume tobacco, whether it's a smoked tobacco product like a cigarette or a BD, or oral tobacco like chewed tobacco like gutka, khaini, do not fully recognize the harm that is caused by tobacco. And they do not realize what kind of deadly diseases it can cause and in what very many ways it can kill. To give this knowledge, it's important that we have pictorial health warnings on all tobacco product packages. We must clearly convey to people who are likely to be attracted by tobacco or are using tobacco the nature of harm caused by tobacco. And nothing conveys this with greater clarity than the picture of cancer or heart attack or gangrene. These are only some of the major diseases caused by tobacco. But this information is important to give. Mere words that will not suffice. Many countries in the world have provided for pictorial health warnings on tobacco product packaging, showing very clearly the kind of diseases that tobacco can cause. And these have been very effective. Many consumers of tobacco have started thinking or even practicing tobacco cessation, trying to give up their tobacco habit after seeing these warnings. And it is an absolute right of the consumer also to know what kind of harm can be caused by the product. So the tobacco industry owes it as a duty to the consumer, whereas the governments owe it as a duty to the people to give adequate knowledge, which is important for public health. Unfortunately, our health warnings in India have not been very effective. So far, we have had very weak warnings put in because the tobacco industry has aggressively resisted strong health warnings being placed on tobacco product packages in India. If we really want these warnings to convey a clear message and give the information that they need to provide, then we need stronger warnings like rest of the world. If we don't do that, we are only fooling ourselves thinking that these warnings are likely to be helpful in giving people adequate warning and caution. We must also recognize that these warnings are now recognized as an important part of our obligations to the people, whether through the Indian law called COTPA or whether through the International Tobacco Control Treaty called the FCTC. These laws or agreements mandate that we provide adequate health warnings to the people who are likely to be targeted by the tobacco industry. If we fail to do so, we are failing in our obligations to fulfill the requirements of the law, and we are failing in our duty to the people of India. So it is absolutely important that we in India get strong and clear health messaging through pictorial health warnings, because pictures convey much more than words can.
Section 7 of the Indian Tobacco Control Law, Cigarettes and Other Tobacco Products Act 2003, mandates that no person can produce, supply, distribute or import any tobacco product unless every tobacco product package carries a specified health warning, including a picture as specified in the related rules. The Indian government notified one of the strongest pictorial health warnings field tested by Hriday in July 2006. This move was met with severe resistance from the tobacco industry. Earlier packaging and labeling rules of 2006 were amended further with weaker pictorial warnings without skull and bones, which were introduced on September 29, 2007. Finally, a group of ministers constituted to reconcile the issue diluted the already existing strong and field-tested warnings and introduced a set of mild warnings on March 15, 2008. Hriday, along with the Advocacy Forum for Tobacco Control, a national coalition of 65 tobacco control organizations, initiated large-scale media advocacy efforts urging the government to implement strong pictorial health warnings. AFTC members collectively sent appeals to the Prime Minister and the GOM in May 2007, seeking the enforcement of pictorial health warnings without further delays and dilution. Student representatives from several Delhi schools, part of Hriday's school network, met the Union Health Minister Anbumani Ramados, requesting him to convey their support for pictorial health warnings on tobacco product packages to the Prime Minister of India. This meeting received widespread media attention and was successful in disseminating important messages on health warnings to the masses. The new warnings were to be enforced on May 31st, 2009. In November 2008, Health for Millions Trust filed a public interest litigation against the Union of India and two leading tobacco companies. Following this, the Indian government took an undertaking in the Supreme Court that pictorial health warnings on tobacco product packages would be mandatory from May 31st, 2009.
The delay on the part of the government was because the industry was pressurizing them, and that's the hallmark of the Indian scenario, that the industry is very strong.